Hey everybody, it's Dr. Aaliyah with another episode of And I Should Care Because, the podcast where we talk about higher ed policy changes and I help you navigate those changes one news story at a time. Not gonna hold you. Today's topic is, I'm not gonna say a downer, but it's something that's sometimes hard to address. We're gonna be talking about mental health and college. So make sure that you look at the two links posted in the description box. That's, always helpful information. I always encourage you to read for yourself. We're going to do kind of a combination of things, and we're going to try to keep it as light as we can, without diminishing the topic. Because I think that sometimes talking about mental health, it can be a little bit challenging because everybody's like secretive. I think that it's changing, but I think that talking about issues of mental health is still a little bit difficult to do. So, without further ado, let's just get into it. There's two stories that encourage me to do this podcast today. And the first is that there's some emergency relief funds that colleges were given due to the COVID pandemic. And there's always restrictions on how you can use money, okay? And it was clarified by the education department that you can use these funds to improve mental health services on campuses. So it's not only allowable, but strongly encouraged to do so because the need for mental health services is on the rise. And it's not just for students, it's for faculty and staff too. So we have that story. And then there's also another story, which isn't as much of a story as it is an infographic. So it talks about many different ways that professors can reach out to their students and be more proactive in maintaining positive mental health and helping students and rescuing students before they get to that crisis point. So we're going to talk about kind of what you might see in the classroom and what it might look like, because I know sometimes you're not used to professors reaching out and being like, hey, I care. Like that, not to say that that doesn't happen at all, but sometimes it might feel weird because it's not what you're expecting. So it may look different depending on who it is that's doing the outreach. And there are certain resources that are always available that you need to know where to look so that you can use these resources. So before we get into all of that, what we're first going to talk about is the fact that even before the COVID pandemic, mental health was not really talked about, and it's something that on college campuses, very much important. Because think about it. You've got life, the ups and downs of life. You've got the news. So if you just Google news, right? Somewhere in the top stories there's going to be something that makes you sad, okay? There's going to be something that makes you feel away. And then when you add the COVID pandemic on top of that, it was just like, whew, too much. And then you go to college and there's so many responsibilities, there's so many things that you have to do, and it can be overwhelming. So all of those things put together was just like, man, we need to do better. We need to take care of ourselves. Faculty, staff, students, everybody. We need to do better. And I think that the first step to doing better is talking about the issues that we're having. So I think that faculty, what a lot of students don't know is that the culture of being in higher education is sometimes toxic. The idea that if you want to be successful as a student, you have to pretty much be this machine that can just go, 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 do all your classes, do all the classwork and all the things. And then if you have to work, you work. Like, you're just expected to keep going, going, going and get everything in on time and give everything all the hours of studying that it needs. And the expectation for professors is very similar. The expectation is, well, you know this stuff, so you teach all the classes, you do all of the grading, you do all of the service, you do all of these things, And if you're tenure track, then you're also going to be doing academic research, and there's no break. There's no way to say, "Hey, I need to sit down for a minute." The schedule is a little more flexible. You kind of make your own hours to do certain things. But the expectation is that you're pretty much working every day. And there's no way to get around that because you have so many responsibilities as a professor. So if that's the culture that we're starting with the professors, and we're not even going to talk about administration at this point, the expectation for students to do the same, well, it makes sense, right? So it's unhealthy. We don't prioritize maintaining ourselves. We don't prioritize self care. And I'm not just talking about taking a shower and washing your hair. I'm talking about mental health, your emotional health, and making sure that you're getting all of your needs met. It's something that we all need to do. And it should be taken seriously. Just like if you go to the doctor for your wellness visit every year, or at least you should. You get your vaccines, they check your blood pressure. Sometimes they'll do some routine blood testing just to make sure that everything is still working the way it's supposed to be working, that there's no warning signs of anything on the horizon. We do those things. We promote those things. But we don't promote the same thing when it comes to our mental and emotional health. We don't use preventative care to make sure that we avoid a meltdown. And I think that we should. So what I really liked at one of the universities that I was teaching at during the COVID pandemic was that they started implementing mental health days, like mental wellness. I don't remember the exact name of it, but it was a couple of days during the semester. It was just like, nah, we're not having class. Professors, if something's supposed to be due on this day, make it not due on this day. Just give students the opportunity to have a break. And while most students probably still did do work or whatever, it was nice to know that at least you didn't have to go to class, that you weren't going to have a test on that day, that you weren't going to have to submit a paper that you forgot about and had to work on while you're at work. You know what I'm saying? So it was a good first step to preventative care when it comes to our mental health. So I appreciated that, I mean, I've got kids and homeschooling. So it was nice to say, okay, you know what? I mean, I still need to do some sort of responsibilities, but I'm going to maybe focus more on my family today a little bit, more than I usually would be able to if I had to teach. So it was really helpful. And I think that's something that should definitely be continued into perpetuity, like forever. So that's one thing. Preventative care for mental health, we need to do it. And it's not just students, it's faculty, staff, everybody. The other thing that you may not know as a student is that professors are not trained to recognize mental health issues. By and large, training is if somebody tell you they're feeling away, send them to the counseling center. Give them the information on how to get counseling services on campus. And that's helpful, but that's not enough. So recognizing when a student is on the verge of a meltdown, recognizing when a student is disengaging and, having a toolkit for approaching that student and dissecting the problem and getting them the help that they need before they're fully gone. We don't have that training. I'm not going to say it isn't available, but it's not something that's, you get hired and then you have this training. Like that's not what happens. So professors are very much not prepared to help students identify when they're in a mental health crisis. And the best that we have is our own experiences and saying, hey, go to the counseling center. Not to mention, professors are dealing with their own stuff. And so if they're dealing with their own stuff in their own life and they just have to suck it up, it's a lot harder to be like, well, student, I have to suck it up and deal. But you're a student, so you don't. But I think that it's harder to give that compassion and have that understanding when you're like, ain't nobody gonna give me no break. And if I take a break, they're gonna take my paycheck too. Like that's tight. That's difficult. So I feel like the training for professors needs to be better. Um, we can talk about that forever, but I just want you to know that it's both sides. Like, no one's really prepared. No one knows when they're going to have some kind of a crisis. It's not like, oh man, okay, it's Tuesday, it's crisis day. Like, that's not what happens. If it were planned like that, we'd probably be able to deal with it a little bit better. But it ain't. So that's just what it is. When I first started undergrad, my grandmother died like orientation weekend. Like, I was moving in and meeting people and learning names. Hadn't had a class yet. And I found out that, so move in on Friday. And when my dad called me on Sunday, he was like, yeah, so your mother went to the hospital Friday night. And then on Saturday, your nana passed. And I was just like, what? I haven't even had class yet. And I'm contemplating having to miss school to go to the funeral. And when I approached my professor about chemistry lab, which I had on a Friday afternoon, it's a terrible time slot. But I didn't do the scheduling. I got stuck with it. The answer was, well, there's no makeup for labs. So if you go, you just gonna miss it. Okay. Like, that's, what do you do with that? Right? So I had to choose between staying and not missing class, the first class, or going to be with my family. And I felt pressure to stay. So I stayed. I didn't go with my family. And people were nice, but there was no compassion. It was just like, sorry that happened. This is still due. Like, that flexibility wasn't there. And the flexibility is needed in order to be compassionate. So I feel like professors really need to understand that just because they may not get the grace doesn't mean that students don't deserve the grace. And if we start it somewhere, then maybe it can kind of be a, bottom up approach. Anywho, it's just to say that you're not alone. Life happens, things happen. And some professors are more in tune with their students to recognize when life is lifing. But even when they recognize it, they don't always know what to do. So this infographic that I was talking about, it has some tips on what professors can do to reach out. And I think it would be helpful for you as a student to recognize when someone's trying to reach out to you. Because if someone's trying to reach out to you to say, hey, what's going on? Maybe that's time for you to stop and take stock of what is going on and see if there is some kind of a crisis on the horizon, or you're feeling away and you've just kind of been burying it, you know? So the biggest thing is that professors should try to get to know their students, like, for real. Know their names, know their faces, and know something about them. Know, why are you in school? What are you looking to do? Just something. It doesn't mean that y'all got to sit down and, share chicken wings. Like, that's not what I'm talking about. But having some kind of a relationship with the students to show up to class and to be able to say, hey, so-and-so, missed your face, like, that really goes a long way. I remember I had a biology class, and I was one of those people that I just never missed class, because I was like, look, I'm here to learn. I'm here to get all the things. And if I'm being in debt for this, I'm going to get everything. Not a scrap will be left behind. So if I didn't have a fever, if I was not actively, vomiting or something, I'm going to class. Is that healthy? No, because you can still get people sick. So don't be like me. It's a terrible idea. But that particular day, I was really down and out. So I did miss class. And the next lecture, when I was in class, after class, the professor was like, hey, missed you yesterday, last class. What's going on? Are you all right? And I was like, you notice me? Now, I'm going to be honest. In the back of my head, I was like, I know I'm the only brown person in here, so it's real easy. It's real easy to know when I'm not here. But the fact that he said something and was like, hey, are you okay? That meant a lot. And so you have to know your students and you have to know their names and stuff and feel comfortable with reaching out and say, hey, I ain't see you. I ain't see you on Monday. Where you been at? Or to say, nice to see you. I'm glad you're back. Something like that, It really depends on the student and the relationship, what you say. But I think it's really important that we do say it. And students, when someone approaches you or they're trying to get to know you, don't be so standoffish. I know it's easy to be like, man, why are you interested now? Don't do that. Let people in. Because it's the only way that you can get the help that you need. And sometimes you don't realize there's a problem until the people around you are like, your pants are on fire. And you're like, really? What you talking about? I don't feel... Oh, wait. I smell barbecue. Like, you need other people to kind of pour in and say, hey, intervention time. Maybe there's no intervention banner. But you need people to pour in and say intervention time. The other thing that I'm going to cover quickly is look at your syllabus. I know that's a really weird thing to say in an episode about mental health, but oftentimes there's kind of like this boilerplate that you have to include in your syllabus. So the actual details of the class, like what's required and, exams and all that stuff, grading, all that stuff only takes up a few pages. But a syllabus is like 20,000 pages long. And we're going to have an episode where we talk about how to read a syllabus and how to use it to your advantage. But that ain't this episode. We're just going to talk about it a little bit. Usually after the information that is most pertinent to the course, there's like 5 pages of, departmental stuff. So it's stuff talking about academic dishonesty and policies around that. If there's field trips or off-campus excursions, and there's something about that, rules for how to handle yourself and what happens if you don't be acting right. And then there's also usually something that talks about resources. So talking about the library, digital resources, you could rent a laptop, but also mental health resources. So talking about the counseling center, when it's open, how to reach them, crisis hotline, like all of those things are actually in your syllabus. So if you just happen to have a random syllabus around from the last couple of years, it very likely has some kind of information in there for that. Also, there's usually email blasts that talk about the events that are happening on campus. And kind of tacked on to the end of that is this long thing about resources and stuff. The library is open. And there's also usually a thing about counseling services that are available. And it's not really highlighted well. It's not like, hey, look at this, or you should use this. It's just kind of tacked on like an email signature, something that people just ignore. And I think that being mindful and purposeful when we're talking about using these services and how helpful they can be, I think if we do that, then maybe people will be more likely to use them and to know that they exist. Because there's a lot of students that don't even know that there's a counseling center on their campus that they can use for free. No copay, no nothing. You don't have to have insurance. You just show up, or you make an appointment and show up. You call and somebody is able to talk to you like that day. So I think that we need to talk about mental health, and we'll talk more about it, more about some of the ways that professors reach out and some of the ways that you as a student can maintain your own mental health, because the only person that really knows what you need is you. But if you're not tapped into what's going on with you and you're just kind of trudging through life, and not taking stock of what's affecting you and how, then there's no way for you to declutter your brain. There's no way for you to process your emotions and be at your full capacity to do your best. When I was dealing with the passing of my grandmother, I had a lot of emotions surrounding that. Because it was more than just her passing, It was years of her being sick and how that took a toll on our family. And so it was processing all of those things on top of the loss and then feeling guilty about choosing school over going to be with my family. So that was a very long process. And it probably could have been shorter if I would have acknowledged that it was even happening. So probably for the first couple of years, I mean, yeah, obviously I was like, okay, she passed and I'm sad. But that was it, man. So you don't want to have stuff, like you're not yourself. And if you're just getting to know the people around you, they may not know who you are to be able to point that out. So you have to be invested in your own mental health. You have to be invested in maintaining your mental health and a healthy environment for yourself. So I encourage you today to just take the time to figure out what that means for you. Does it mean taking 30 minutes to do something fun, read a book, pick up your guitar? I don't know what y'all be doing. But whatever it is, do something that helps you feel good and is not detrimental to your mental health. Something that helps you see your value, something that helps you see, your uniqueness, something that helps you feel good about who you are, where you are, and where you're going. And if you find that you're not happy about where you are and where you're going, then take the time to figure out why and where you'd prefer to be. This turned out to be a little bit longer than I wanted it to, but it's something that I'm really passionate about. I think that we need to take care of ourselves so that we can take care of each other. So let me know your thoughts about, mental health. Is it something that's talked about on your campus? Is it something that, your family is big on? Is it something that maybe you're like, I never thought about that before? Let me know in the comments. You can hit me up on Twitter. And let me know what you're thinking. Let me know what else you need to talk about in this area, because it's such a big topic. So if there's something specific that you think would be beneficial to talk about, let me know. I'm totally open. I love hearing from you. I love getting suggestions for topics. So just throw it on in the comments or hit me up on Twitter. I hope you have a great day. I hope that you feel empowered and encouraged to take care of yourself. So that's your assignment. Just do something to take care of yourself. Take 30 minutes and do something for you. Have a great one, and I'll see you back soon. Bye.